Hello friends, in this video we are going to discuss about the cecum anatomy, and we will discuss this anatomy in different parts. We will discuss dimensions, relations, blood supply and nerve supply of the cecum. So let's begin with the introduction and the dimensions of the cecum. So for that we will discuss location, where this cecum is located. So here you can see it is the ilium bone, and here that is the iliac fossa. So it is situated into the right side of the iliac fossa. So as we know, it is only present onto the right side. So cecum is located onto the right iliac fossa. Now let's discuss the cecum's relation with the inguinal ligament. Inguinal ligament we can divide into the two parts, medial half and the lateral half. So as you can see here, the cecum is located onto the superior to the lateral half of the inguinal ligament. So that is the location of the cecum, situated into the right iliac fossa and onto the lateral half of the inguinal ligament. Now let's discuss the position of the appendix onto the cecum. So here you can see where this appendix is located. So it is situated onto the posterior side as well as onto the medial side. So we can say appendix onto the cecum is located onto the posterior medially. So that's the position of the appendix. And the cecum is actually the beginning of the large intestine. And we have discussed now the location of the cecum, that is into the right iliac fossa, and it is situated onto the superior to the lateral half of the inguinal ligament. It is the beginning of the large intestine. It is the blind sac. It is related to the ileum and large intestine. Let's discuss the dimension of the cecum. So length of the cecum is around 6 cm and width of the cecum is around 7.5 cm. So we can say that the cecum is more wider. It is the one of the organ which is having a more width than the length. Now let's discuss about the relations of the cecum. In the cecum we will remember the two main relations. One are the anterior relations and another are the posterior relations. So let's begin with discussing with the anterior relations of the cecum. So onto the anterior side, ileum is actually located and the rest is the anterior abdominal wall. So let's bring the skin of the abdominal wall, and the abdominal muscles, peritoneum, everything is situated anterior to the cecum. Now let's remove all the anterior structure and let's discuss the posterior relations of the cecum. So onto the posterior side we will remember two important muscles. What are those muscles are? So first is the psoas major and the second is the iliacus. So let's discuss this muscle a little bit, that this psoas major muscle is actually originating from the vertebrae and passing from the iliac fossa and reaching up to the lesser trochanter. And it is inserting onto the lesser trochanter of the femur. Now let's discuss a little bit about the iliacus, which is originating from the iliac fossa, then passing anterior to the hip joint and also inserting along with the psoas major onto the lesser trochanter of the femur. Now we know that the cecum is posteriorly related to the psoas major and the iliacus muscle. Now let's discuss about the posteriorly nerves which are related to the cecum. So we need to remember two nerves. One is the femoral nerve and the second one is the genitofemoral nerve. So as you can see here, there are two nerves, femoral and the genitofemoral nerve, which is located posterior to the cecum. Let's understand the posterior relations of the vessels. So into the vessels we will remember testicular vessel into the male and the ovarian vessels into the female. So they are situated posterior to the cecum. And appendix, if the appendix having the retrocecal position, that means the tip and the part is going behind the cecum. So if it is a retrocecal appendix, which is the most common, situated posteriorly. Now let's discuss the blood supply of the cecum. Cecum is also part of the midgut. So the main artery of the midgut is the superior mesenteric artery, which is the branch of the aorta, descend down and it gives a branch which is known as the ileocolic artery. From the ileocolic artery there are the cecal branches which will emerge and supply to the cecum. So here you can say ileocolic artery, and they are giving the branches, cecal branches, which supply the cecum. Blood supply, arterial supply. Now let's discuss the venous drainage. So into the venous drainage, reversely we will remember the cecal branches drain into the ileocolic vein, and ileocolic vein goes into the superior mesenteric and superior mesenteric to the portal. So that's how ileocolic vein drain the cecal branches. Now let's remember the nerve supply of the cecum, and into the nerve we will remember two things. One is the sympathetic and another one is the parasympathetic. Sympathetic nerves, actually they are from the sympathetic ganglia T11 to L1 ganglias, and parasympathetic nerves, actually it is supplied by the vagus nerve. So that's all about the cecum. Thanks for listening.